Thank you for that question. The Kenyans have the mentality. It depends where one is coming from. We come from different cultures and different traditions and different orientation and different education background and everything like that. There are communities who believe girls are not supposed even to go to school. We have communities who believe that, and you know it, you're in the media and you know it.
No, I don't. Educate me.
Judy will tell us, and they have been in the field.
Okay.
Me, I'm in court.
Okay.
Yes.
I will allow that.
Who come to court. So what happens, there are people who believe that a girl is supposed maybe to be circumcised and they be married off, and that is it. So what are we trying to do? For us as an association, we are trying to do in our strategic plan, we want to start mentoring the girls. Because there are some girls who know, for example, if you become pregnant, that is end of story. They don't know that you can get pregnant, have your baby, still go back to school, and that needs the support of the family. And that is why our vision is justice for all, and especially gender justice. That is warm, that we are committed to it. And that when you come to our court, we have that human face. A girl comes, a child, she's pregnant, she's 11 years old. And are you going to school? No, I can't go to school. No one will be able to take me back to school. So what systems do we have in government especially? I know we have the Ministry of Children and Gender,
yes,
and all that. Are we not supposed to have programs that take care of these children? What happens in that space?
Right. It's an election-year period, and half of these sort of important conversations, and not just this, you know, the question for mental health, for instance, that affects a huge section of all of us, literally, is not part of the conversation in politics. A whole education system is not part of politics. Obviously, GBV is not part of politics. What do you think is our problem, say, as voters, right? Because we should be demanding this, but we're not.
The biggest challenge with the Kenyans, we forget very fast. We are very easy to please. You know, I come here, lie to you, tell you that I can do things that are not even, you know, like this is not what you need immediately. I'm saying people are running for office to lead a sick nation. This is a sick nation because we are waking up like to news where a father wakes up and decides to kill everybody in the family. And these are the people who are supposed to be the electorate. These are the people that, again, you are seeking votes from. And that's why we are saying the leaders, the candidates have to really put some of these things on the table. They have to address the social challenges that we are having. And one of them we can't run away from is the ISOL of GBV. We can't run away from the mental illnesses. We can't run away from the causative factors, which I'm asking. How comes the GBV cases have escalated so fast and in, you know, very shocking levels? We need to identify what is happening to the people, what is making them to do that. Without us checking, and even checking at the perpetrators, why are they doing this? If we don't address it from both ways, and that's why I'm saying it starts with the leaders that we elect. It starts with the willpower. It starts with the willingness to address the things that are ailing the society, the things that are affecting us. And that's why the Association of Media Women in Kenya, we've decided as we go to the election this year, we have to start picking already when we see issues already, you know, being reported to us. Like recently, we received a video clip, a young girl, not a girl, she's a lady, a young lady, she's 26 years old. She said she wants to run for MCA. Then a song is produced telling her, we cannot give you votes. The only thing we can do for you is to rape you. So what happens to this lady when she goes to the field? The song has been done in the local language. So what are you telling to the people when she goes to stand there? I'm very happy recently when a man slapped a woman at a campaign rally, the police took action and this person was arrested. So we really have a responsibility, and even political party leaders in the country, whatever they have to take responsibility for whatever they are doing. We cannot start, you know, normalizing everything. We have to start stopping this thing, because at the end of the day, what is going to happen if the people we expect to vote for us are sick, they're killing each other? What if we like kill each other? Who are we going to lead? Who are we, you know, going to be accountable to? So I think as we move to the elections, we have to start asking those questions. And also the media has a very big responsibility to play. It's not about being sensational. It's about us going deeper into issues, asking the hard questions. When we have the presidential debates, these are some of the things that we should not miss. on the discussion table. We cannot just talk about the economy and not looking at the relationship between the economy and the impact of violence that we are talking about. So all these things are interrelated, because you look at it, when someone dies, what happens to them? Maybe it's the breadwinner of the family. Maybe this is somebody who was working somewhere. So there's an impact when you look at the society itself, the politics, the economy, and all this. So all this is interlinked politically. And if we are not going to ask those hard questions, we are just going to be superficial and just tick boxes of the manifestos, write all those things that are even impossible to achieve. We really have to look at what is ailing the society and let them tell us how they are going to address that. Unfortunately, some of them are abetting it. That the perpetrators, they're already making the indication. You can see even the verbal exchanges. That's how it starts. Before now it gets physical. It starts with me demeaning, a victim, with me, all those words. That's how it starts before we find that someone is already in a crisis.